Veneers. This is the hot topic of dentistry today. We are a society driven by aesthetics, and there's a lot of issues regarding the aesthetics, all aesthetic dentistry of whatever kind. So today I'm going to talk a little bit about veneers. We're going to do tasks, and we're going to talk about the veneer terminology. Now we're going to talk first about the terminology. So what are veneers? What are the terms that we use with veneers?
Laminate.
Okay, refer back to glossary of orthodontic terminology. So that's task number 1. Bring out from the glossary anything related to veneers, okay? But what the main confusion that happens is the difference between how we use the term in the textbooks from what we have it actually. So when I'm saying I throw the word veneers, I'm talking about laminate veneers. So they are laminated on a surface. They are stuck to a surface by a glue. Anything laminated is something as a surface added to another surface by some adhesive in between. So it's laminate veneers. In textbooks, you will find veneers talking about complete veneers, meaning crowns, and partial veneers that we're talking about. So they call it laminate veneers. So this is that first confusion that happens between the terminology. Now, the second confusion that happens with veneers is the way the classification of veneers happens. Okay, you will get in textbooks the veneers, they talk about veneers, and you will find, I found in one of the textbooks, only one type of veneer that's they're talking about only an overlap design. Only. They didn't include anything else. In another textbook, the veneers is only a part of the procedure. The third one did not even mention veneers in its fixed prosthodontic textbook, although it's a fixed prosthodontics textbook, okay? So this is one. Then there are people that talk about classifications. They call it partial veneer and complete veneer, okay? The partial veneer, they mean something that covers only part of the tooth. So I'm talking about partial veneers. And when you talk about partial veneers, how much partial is it? We're talking about, this is we know veneers is most famous for anterior teeth, so I'm going to give the example of anterior teeth. So partial veneer is what? How much is it partial? You go from a small bit, you can add a button of veneer, and you can add to the total veneer. But partial means still not covering the full facial surface, okay? In other books, they will call it a window veneer, okay? Window, meaning that if I look at the tooth facially, I will still see enamel. I will still see part of the enamel. It's not only a margin, and by the way, sometimes you have a margin, but you don't see the enamel. But how do you see the enamel? Okay, here you see enamel. So complete coverage is where the confusion also happens. And how much complete coverage do we have? Complete coverage in some books, the complete coverage is either incisal, reaching the incisal bit, okay, and then overlapped to the palatal side. The incisal itself has different morphologies. So this is the incisal morphology, okay. Let's say this is the incisal morphology, okay. And you need to place a veneer here. We will see that there are some veneers that are facial. They consider it facial, where they end on the incisal edge. Okay.
Feather.
Okay.
Feather.
Okay, feather edge, whatever you call it. But the idea is that it takes part of the enamel on the surface. So the veneer comes here, part of the enamel, and it continues covering whatever. So it's part of the enamel. So the incisal edge, the original incisal edge, part of it is original enamel, and part of it is veneer. But this is a full veneer. Then we have the other design, where we don't only prepare let's go back here, where this is the incisal edge, okay, and we come with the full coverage veneer, and we do a butt joint here, okay, a butt joint, and this butt joint is usually inclined palatally, okay, so this is all our veneer here. The veneer is part of the surface, okay, but the cutting is like this. The overlapped, once more, this is the incisal edge, and the overlap means that I'm preparing my veneer going more palatally on this side. Okay, this is palatally. Now, all of these veneers don't talk about the contact area. So when we talk overlapped, it's overlapped incisally. Then you will get other people talking about overlapped proximally, proximal overlap, and they call it even a super veneer. Okay, so the terminology of a super veneer, what is that? They will talk about having the tooth. Let's say this is the proximal surface. Okay. Oh, sorry. The overlap is usually palatally. Okay, and we have a contact area here. Say we had the overlap design, so the overlap design is going like this, and coming palatally with the finish line here. Okay, this is the contact area. Now the super veneers, they take also. Now this is the, if I'm looking labially, if I'm looking proximally, if I take the tooth, this is it's the proximal cross section, but showing the labial reduction. If I talk, this is the tooth facially. Okay, we talk about overlapping. This is the facial view or the lingual view. Let's say this is the lingual view to show you what means I mean by the overlap. So the overlap comes from here. These are super veneers. Okay, and you will get also an overlap proximally. So it includes the contact areas. Even if there is no contact, I mean there is a diastema, but the idea is wherever ideally the contact area is, it's supposed to be here. So even if I have diastema, this is also called crossover the contact area. Okay, so it goes lingually, and what is left of the tooth is this morphology. And this is challenging, by the way, because I need to do a path of insertion. So irregular margins are not allowed. So it overlaps from the incisal, from the facial up to the palatal. Okay, and it overlaps from the labial into the palatal from the sides as well, proximally. They call these, I found somebody calling them as super veneers. Okay, I love that video. I'm going to give you the link maybe in the descriptions. It's a good list. I find, because once more I'm talking about the gap between veneer technology in textbooks, prosthodontic textbooks, and what we have now. And when you go for searching for textbooks on veneers alone, you will find the beautiful textbooks, but once more there's a gap. Even in the last 5 years, the technology of CAD/CAM procedures and the technology of smile design had advanced so much that what you find in books before 2015, for example, 2015, you will not find it relevant to what we have today. We have a lot of advancements in smile design and CAD/CAM technology. So the terminology is going further. There is also a lot of discrepancy in terms of the material used. What was allowed us to use? What are material for veneers?
Material.
Materials.
Normal.
Thicknesses. There's only. Okay, let's say lithium disilicate, because this is the most aesthetic material that we had. Okay, whatever trademark. I know it was this term. This lithium disilicate was copyrighted or had a patent for one of the companies. They kept it for so long. There were nobody producing it other than them. But maybe in the last 2 years, I think the patent ended. I'm doing some research on monolithic material. So their patent had ended. So now more companies are producing lithium disilicate. So don't keep. Now we're talking about the gap. Now what we have general knowledge and what we have advanced. One of them is the patent had ended. So more companies are allowed to produce lithium disilicate. Sorry. Okay. What do we have also? Porcelains, whatever, feldspathic or any other porcelain, because also we have new advancements in amount of the filler that we have inside the porcelain and the chemical structure of it. Okay. What do we have also? Zirconia. But not regular zirconia, because zirconia. So it's not tetragonal yttria. Okay, tetragonal zirconia. No, this is not aesthetic.
Yeah,
okay,
it's very opaque.
It's very opaque. So we're not talking about the zirconia. We're talking about advanced zirconia. Advanced zirconia meaning monolithic, aesthetic. Some of them. This is another way where we have a lot of confusion in zirconia. Because zirconia, by default, we all know it as the chalky material that we use only for cores. It's not allowed to. It's not allowed aesthetic. Now, with the explosion of monolithic material, we're talking about this research. I've done a literature review. I found 98 monolithic material. Okay, my master students are doing a review on this. So their work had produced 95 trademarks of monolithic material. So the monolithic material is also a huge explosion of material. You have to know that new material are recommended for veneers, but talking like if you tell somebody zirconia as a veneer material, this is a huge mistake you're talking about. So it's not regular zirconia, it's monolithic aesthetic zirconia. Okay, we're not talking about regular zirconia. What are the traditional material? Metal can be used as a veneer. So sometimes we need to veneer palatally because I want to add a chamfer, for example. Rest preparation. I want to add on the surface a chamfer to work as a rest preparation. So how do I do that? I produce a button on the side. Okay, so it's a metal veneer.
For the porcelain veneer, you see, you mean the porcelain on top of the metal, right?
No, not porcelain fused to metal. Porcelain,
okay.
Pure porcelain.
Pure porcelain.
Pure porcelain, yeah. I'm not going to trademarks because this is also a lot of evolving, but porcelain as a material, pure porcelain without any metal. So zirconia. So metal have specific purposes. Okay. Okay, what else we're talking about? Metal, composite, yes. And some composite now is either direct, you do it in your clinic, or indirect even. Now I found today while I was working, because I know it's advancing and exploding in technology. Now I went to while I was searching and preparing for this lecture, I found indirect composite produced by CAD/CAM. Wow. So it's a temporary material. You place it temporarily because maybe the patient needs to do something urgent. He has a wedding, he has an occasion, a ceremony, whatever. He has a talk, a visit, an official visit. So they are in a hurry. They want something very quick. They want to put it in their mouth and be durable. If you put a mock-up material or temporary bridge material, it will fracture off. It's not safe to place temporary material as a mock-up and as a temporary for the patient to go with because it's not strong. So I found that they splint multiple veneers using composite. So they make the veneers out of composite and they're splinted for temporary reasons. So the composite can be direct, you do it in your clinic, or indirect, done in the lab. It could be done on a cast, regular procedure, or CAD/CAM. Okay, so these are a lot of material. Then you have a lot of thicknesses. Now, some companies don't. Okay, let's say if you go deep into their data sheets, you will know the material. But if you look at the quick view of their website on their website, you will not find the material they're using. Okay, you don't know what it is. But it talks about the thickness of the veneer. The veneer thickness least is how much?
Veneer thickness.
0.3.
Okay, it's 0.3. It's the least. Okay, and it could go up to 2 millimeter incisally. Okay, but not more. Incisally. I'm not talking about enamel, because the amount of reduction is first of all site specific. Okay, and it's also material specific. How much does the material tolerate? Let's talk about the site specific issue, because study done by a group studying the enamel thickness going from the cement to enamel junction. They went from the cement to enamel junction 1 millimeter down, 2 millimeter down, 3 millimeter down. So they have they reported the 3, they reported the 5 millimeter down. How much thickness do we have? Okay. At the 3 millimeter down, they found that the enamel is 0.03. It runs on the cement to enamel junction. We have the differentiations between the different cement to enamel junction. I'm talking about that in a moment. 3 millimeter from the cement to enamel junction, you're about only 0.3 enamel. At the 5 millimeter, it's 0.7. You have 0.7 of enamel, and then it comes a bit thicker and more on the incisal edge. You have around 2. You can go up to 1 or 2 millimeters veneer. But the 2 millimeter veneer is not in enamel, but you overlap to go for the palatal enamel. So not always the 2 millimeter is enamel, okay? So the incisal edges, how much enamel is on the incisal edge, it's not determining your preparation, because we know that the incisal edge is so variant between the young patients and the old patients, because what happens with this? It keeps wearing off, okay? So what we're talking about when we talk about what you see in some videos, we're talking about how much you prepare on the incisal edge. It depends on how much enamel is left. And many times in old patients, we don't have a lot of remaining enamel. Sorry, these are young. In the old, we are very close to dentine. This is dentine. Okay, so if you pair the 2 millimeter preparation, okay, sometimes you're indenting. Or sometimes the 2 millimeter preparation, or let's say 2 millimeter thickness of material on the incisal edge. Suppose this is the incisal edge, this is dentine once more, and I'm adding to it. Sometimes it's not about the enamel. Sometimes I am elongating the tooth to gain some compensation in aesthetics. Okay, so this is the original enamel we're talking about. This is enamel. Sometimes I need to elongate for other purposes like aesthetics. Okay, I'm increasing the length of the crown. Okay, so doesn't mean we have 2 millimeter of enamel on the edge. The amount of enamel on the edge is variant by the wear, by the age of the patient, and by how much I'm going to add to the incisal edge or occlusal surface. So to overcome this, we overlap to the other side. Wherever dentine is exposed, it's preferred to overlap to the side where we don't have dentine. So this means we have different types of different thicknesses of enamel. Let's talk about the enamel at the cemento enamel junction, because this is an issue where many people don't understand about when we talked about the difference between veneers and partial coverage crowns. Okay. On the cemento enamel junction, we have different types of morphology. So say this is the cementum, this is the tooth. Okay, let's say this is the dentine joining in. This is dentine. This is the cementum. What are the types of morphologies we have for enamel? We have 3 types of morphologies. We have open margin. The enamel is away. Remember that from the histology. We have the enamel away from the cementum. We have here actual exposed dentine. Okay. We have enamel touching, edge to edge, and we have enamel over cementum. Okay, so these different morphologies of enamel in relation to the cementum will also guide how much I'm going to prepare on my most gingival finish line. Okay, because still I will say always my most gingival finish line, not referring to the enamel, because it's by default you always stop on enamel. Whenever you don't have enough enamel where you want to end, and the gingivas say this is the gingiva, and the gingiva is exposing the root, and you have either over erupted teeth or teeth that have recessed gingiva because of periodontal reasons, you need to go here to this area where no enamel is present. We go back to partial coverage crowns and we make a proper finish line, and there we are talking about retention grooves. We're talking about definitive overlapping to the palatal surface from the proximal and the incisal to grasp as much as possible to do the encirclement. We are now depending on the dentine for bonding, not to enamel bonding, and it's weak. Okay, so partial coverage crowns means that we have finish lines that are compatible with the material, so it should be thick, a bit thicker than chamfer, depending on the material once more, but the idea is we observe how much thickness of material we should have at the margin. Based on that, we design our margin. So porcelain is thinner, lithium disilicate is a thicker material. It's strong when it's a bit thicker, so we'll have deeper chamfers for lithium disilicates, and if it's metal it's shallower and so on.
دكتورة معلش يعني أنت بتحكي إنه إذا التايب مش اللي في بينهم فراغ لازم نروح للبارشل كفرج.
Yes.
طب كيف
Now I'm aesthetically driven. Once more, aesthetically or prosthetically driven. By the way, when I talked about prosthetically driven, now it's aesthetically even. This is the new trend. Aesthetically driven, not even prosthetically driven. Okay, aesthetically driven, I need to cover anything exposed and reach up to the gingiva, correct? So what do I do if my enamel ends up here? And this is cementum. So I'm coloring them so we could differentiate. And I have a dentin exposed. What will happen now?
أغير
You have to change to partial coverage crowns.
طب كيف رح نعرف إحنا بالعيادة من اللون؟
No,
صح؟
from the
من
you
اللون
will by color.
والتكستشر.
Okay, good that you've noticed that. You've asked that. Okay. Suppose I have this is my facial tooth. Okay. And I need to know how much enamel is left. I don't know. There is a patch where I reached dentine here. There was a class 3 here where I reached also dentine. I went in my preparation dentine. I'm not knowing how much remaining enamel is there. And maybe in some areas I thinned out the enamel, but I'm not sure did I reach dentine or not. I'm still confused. How much enamel do I really have? This is easy. What you do is do a full coverage with acid etch. Okay? You cover the facial surface or whatever surface you're looking for, the enamel. You cover it with your acid etch. 10 seconds. Wash. What will you get when you wash? Chalky appearance. Chalky appearance tells you where the enamel is. Okay? So it tells you where the enamel is. So you're confident there is enamel or not. Okay? So this is about how to know. Now, there are other issues we're talking about. When we talked about the material, I told you that we have material that could be worked up to 0.3. This is the thinnest material we have. We don't have it in Jordan, but I remember that they send it to a lab in Germany, and they will send you back the veneers. You send your casts, and they send back. Now, when I talked about it, when I read about it, was you send the cast. Now, with the new digital imaging systems, I don't know if you even need to send anything. You might not need to send anything. They actually just send you back the veneers. Now, so this is a 0.3 veneers material that allows you. Going up to other material, you will get different material. Now, these types of veneers that are very, very thin, these necessitate that you don't need a lot of tooth reduction. There are some veneers placed even with zero reduction, but that doesn't mean you're not you place the veneer over your enamel. Now, this is another issue. If you're going to use no prep veneers that are only facial, there is nothing to change. You're just changing the morphology of the tooth. You don't actually need to prepare the tooth. But this is enamel. So let's talk a little bit about enamel, because we know that enamel here is not like the enamel here. This is strengthened by what? Fluoride, huh? The fluoride-rich layer. The enamel has a fluoride-rich layer and has another layer. So even with these minimal thickness material, you will need to scratch off the surface of the enamel. So even it's called non-prep veneers, but you actually need to scratch the surface of the enamel to remove this rich layer, because the fluoride-rich layer is weak in terms of responding to the acid etch. I want to place an acid etch. Why do I need an acid etch? For my adhesive.
بالبير يعني بنعملها.
فالacid etch penetrating a fluoride-rich layer is weak, so the bond here will be weak. So you need, yes, by the bear you scratch the surface by going over the surface without preparing, but actually just producing enough scratch marks that you be sure that you have removed the fluoride-rich layer. Okay. There are other issues I'm going to talk about. I'm going to stop here with this video. It's a bit